me, patient experience is the overall impression that a patient has along their healthcare journey. That includes interactions with the provider that are both tangible and intangible.
Patient experience, I think, starts when they first call to see the physician or the nurse practitioner or the physician assistant for the first time. So it's that first interaction through the entire course. They see the provider, they meet their medical assistant, and then they get the follow-up care afterwards. So it's a long continuum where there are multiple touches by folks, including the appointing staff and the nursing staff, and then of course the providers. And so each one of those steps needs to be efficient and very customer friendly. And I think when we do that, it makes such a difference in the lives of our patients, as well as from a quality standpoint. So the importance of this should be really right at the top for Summit Medical Group.
So for me, patient experience is all about the patient's perception of how we provide care, and care meaning everything from their first attempt to contact us to come in and be seen, all the way through the back end for proper billing to make sure that we do everything right. Did they have the experience and the smooth transition through all of those things as they would have expected to?
To me, I think the patient experience is really the those tenets of the SMG promises, living those out. And those really just come down to treating everybody with respect and in the same way that you would like to be treated.
The HR, recruiting, and patient experience teams understand that we play a big role in the patient experience. We know that the primary driver of patient experience are the dozens of interactions that our patients and their families have with our healthcare providers and our staff. It's not just about the physical aspects of the healthcare facilities. The real difference is made by the people we choose to be part of our team. Good people are not just nice to haves, they are must haves for significantly impacting the patient satisfaction. It's all about the people in my book, the people we choose to add to the team, the people that we will trust to care for our patients. That's where it all starts. My team's mission is to create the right programs and encourage the best environment to help our sites attract, retain, train, and engage the talent that are on all of your teams.
I think if our teams approach each patient contact, whether it's telephone or email or through Athena or in person, if they approach that from the standpoint of how would I as a patient want to be treated and be managed, and when they take that mindset, I think it creates that natural sense for the patient that, gosh, those people really care about me and they're going to do the best for me. And if that's the conclusion they come to, then it allows me as a physician to be able to treat them so much better.
So I think in order to, how we impact that is seeing ourselves as the patient, because we are the patient as well. I think we need to make sure that we're polite, we're empathetic. Oftentimes we're seeing people in their most vulnerable times with their health care, whether it's a chronic illness, a new disease state. Oftentimes there's anxieties and things that go along with that. And so it's really our job to make sure that every day we're acting as that patient advocate and more or less putting ourselves in their shoes and treating ourselves as we want to be treated, or treat our patients as we want to be treated.
You know what I think is just we have to realize that all of us are patients. At some point in time, even the best doctor is going to be a patient. And so we have to, really recognize that it's important for everybody to have that health care and with no fear and no judgment, and that they feel happy to come, in and be cared for and not reluctant.
Because it leads to better patient outcomes, better loyalty from our patients, improved safety, and several other wonderful benefits. When we work together to improve their patient experience, our patients receive quality care, which is our ultimate goal.
There's an absolute direct line between quality metrics, between patient adherence, following the treatment plan, and patient experience. And if you think about it, it just makes sense. When a patient really appreciates the care they're receiving, they develop a rapport and a trust, which is integral for them to actually follow the treatment plan, which will then improve their outcomes, which ultimately, because we're so heavily invested in value at Summit Medical Group, we ultimately benefit from as well. So it helps to really create that double win, where Summit wins when the patient wins. Type of a paradigm. And if we approach patient care in that fashion, it makes all of us happier, the patients happier. Happy patients usually means happy staff and happy providers. So the importance is just paramount.
Yeah, absolutely. Like I said, it's important because it's everybody's responsibility. It's everybody's responsibility to make sure that we're providing the service and understanding the patient, because patients have an opportunity they can choose to go elsewhere. They can seek care elsewhere. But not only that, because we are in so many different communities and we are such great community partners, we're not only the care provider, we're also patients in those same areas. And so that's where I think Summit does a great job of making sure that we are relational, because we are so diverse and each practice knows their patient. And I think that brings a little something more versus a corporate site, if you will, at taking care of patients and making sure that they have a good experience.
You know what I think is just we have to realize that all of us are patients. At some point in time, even the best doctor is going to be a patient. And so we have to, really recognize that it's important for everybody to have that health care and with no fear and no judgment, and that they feel happy to come, in and be cared for and not reluctant.
Thank you for all that you do to make a positive impact on the patient experience at Summit Medical Group.
Well, I know how hard our teams are working, and it is extremely appreciated because it makes everyone's job so much easier when people are focused on providing great customer care. And when patients have had a good experience, then they tend to be ultimately more engaged patients, and it makes our jobs easier from a provider standpoint. And so we're extremely grateful for our staff and all the hard work that they're doing.
So of course I have an affinity to the value-based team for all of their hard work and outreach and dedication that they do to the patients that we do corporately. But it's equally, by far, if not more important, to say thank you to all the teams that are out there doing the things that we know that they need to do every day, and making sure that no patient left behind, much like no child left behind, that they're looking to make sure that every patient is reaching their optimal health. So big thank you for that.
I'd like to thank the IT team for their contribution to our patients and our providers. And I'd also like to really recognize that, the caregivers out in the clinics and everybody that works clinical, they make that whole experience happen. We can keep the systems up, but they're the ones that build the relationships with our patients, and then that's the most important part. So well done, great job, go Summit.
Hi, I'm Ed Curtis. Thanks for joining me today. I really wanted to pass along to all of you my definition of patient experience. And I think the best way to start is when the patient's at home. I think it's very important for them to realize that a product that we use called Epion, now called Kairos, allows you to pre-check in so you're not burdened with all the questions that come up each time you show up at a medical office that ask you about your medications, your past history, etc., etc. You don't have to replicate that. You complete it on Kairos, and before you get to the office, you already checked in, and then when you reach that smiling face of the receptionist, she just asks you to take a seat and wait to be able to visit with your doctor. I hope you also agree that that's great customer service, and thanks for listening.